In the name of Allah, I'm Ahmed Saeed and I will talk about the lobar anatomy of the lung in this video. I want from you to make like and share because the mic is disconnected in the last twice videos and I hit lively bored. Okay, so so I want from you to make like sorry and share. If you don't that, I will kill you. I'm joking with you. In this video, I will talk about the lobar anatomy. We want to know all the lobar anatomy of the lung to can describe the location or the right or the correct location of the lesions and the pathologies. The lung is consist of two lungs, one right and one left. The right lung is larger than the left because it consists of the upper and middle and lower lobes, and the left is consist only of upper lobe and lower lobe. The location of the middle lobe of the right lung that will be in the left, but the heart take this place. The middle lobe of the left lung that was supposed here, but the heart take this place. So the right lung is larger than the left lung, and the trachea is enter the chest cavity and bifurcation in the lung. And this not our issues in this video, but our issue or our main topic is the lobar anatomy of the lung. This is another image that took you that the lung or the right lung is consist of three lobes, the upper lobe and middle lobe and inferior or the lower lobe. You can talk this superior lobe and upper lobe, and you can talk this the inferior lobe or the lower lobe, and this is the middle lobe. Here I talked you that the left lung is consist of upper and lower only because the location of the middle lobe in the left lung, the heart is taken. If you notice that each lung have an apex and two angles, apex and two angles. This apex is the top of the lung, and these angles is costophrenic angle and costocardiac angle, and in the other references talk about this that the costocardiac angle, because this between the diaphragm and ribs, this angle in the lung, but between the diaphragm and the ribs. Here, this angle in the lung is between the heart and the diaphragm, so they talked about this that cardiophrenic angle or costophrenic angle here and costocardiac angle here. But I want from you to know that each lung has apex and two angles, and the right lung is upper than the left lung because the liver is pushed it up and make it upper than the left lung about 1 to 2 centimeters. I want from you to know that the lung is not paper sheet, is not flat. The lung is not flat and have an 3D shape and have an anterior aspect and posterior aspect, and the loops is take an oblique shape. The loops is oblique shape, not flat shape, not like that. Not will be draw the line here and draw the line here and call that the upper loop and middle loop and lower loop. The loops of the lung is take the shape oblique shape, and this is the right lung and consists of three loops, and there are fissures that divided the loops. This is the major fissure, and this is a minor fissure. In some references that call this oblique fissure and this horizontal fissure. We will draw the oblique fissure from here to here to divide the lung into upper lobe and lower lobe. So you notice with me that the upper lobe is anteriorly and the lower lobe is posteriorly and close to the vertebrae or dorsal vertebrae. And we take the line from here to appear the middle lobe. So the right lung is divided into three lobes that divided with fissures, this oblique fissure or major fissure and this minor fissure. This upper lobe and the upper lobe is most anteriorly and lower lobe is most posteriorly and middle lobe is anteriorly also. So this is the upper lobe and the middle lobe and the lower lobe. This another image to make you more understand. This left lung is consist of upper and lower lobe that divided by major fissure, and the right is divided by major fissure and minor fissure to appear the middle lobe. And here not have a middle lobe because the heart is taking the place that the middle lobe of the left lung will be supposed to be here. I want from you to notice with me that the major fissure is originated from here and end before the costocardiac angle, not in the cardiac angle. I will want this information later. It's another image to make you more understand also. Each lung has one apex and two angles, and the left lung is divided into upper and lower lobe by the major fissure or oblique fissure. And this lateral view of the left lung, the lung is not paper sheet, the lung is not flat, the lung is cavitate, the lung is 3D shape. This upper lobe more anteriorly, this lower lobe more posteriorly and big. This a lateral view of the right lung and divided into upper and lower and middle divided by fissures. This is a major fissure and this is a minor fissure that originated from the major fissure to appear the middle lobe. In X-ray images, we will talk about the zones, not loops. The AB or BA projection we will take to the patient, the zones is subdivided into three zones, the upper and middle and lower. Middle in the center and upper and lower zones. If the lesion is here, we will talk this in the left upper zone. If here, we will talk this in right middle zone. If here, we will talk this left lower zone. At first, we will revision the each lung has apex and two angles, apex and two angles, costophrenic angle, costocardiac angle, or cardiophrenic angle, and this location is for the heart, and the heart take the place that's supposed to the middle lobe of the left lung, so the left lung hasn't a middle lobe. We will talk about that how to make sure that the chest X-ray is taken with a correct way. This is the spinous process of dorsal vertebrae. We will comparison the distance between the clavicle and the spinous process here, and this distance between the clavicle and spinous process here, or the trachea and the distance between the trachea and the apex of each lung. If these distances is equal, you make sure that the patient is erect in correct way. So we will notice the distance between the trachea and the apex of each lung, or the distance between spinous process and each clavicle. And we will make sure that the right lung is upper than the left one between 1 to 2 centimeters. And we will make sure that the costophrenic angles and costocardiac angles or cardiophrenic angles appear clearly. There are a major sign in the chest X-ray that called cardiothoracic ratio. Cardiothoracic ratio is the line that we draw that between the distance location or the distance border of the heart here and the distance border of the heart here, and we will draw the line between the distant border of the costophrenic angle and the distant border of the costophrenic angle here, and this line should be less than half the length of this line. If this line bigger than the half of this, the patient is cardiomegaly. And you will make sure that the projection is taken BA or posterior anterior, because in the projection of anterior posterior or AB, the large will be far than the cassette, so the heart will be appear more magnified. And some doctors believe that the patient is cardiomegaly, but the patient is not cardiomegaly. The patient is erect and projection with AB or anterior posterior. So I want from you to write here the position or the projection of the patient, and here right or left. When we talk about the loops in the AB or BA projection chest X-ray, we will not can define or refer to the loops because it is a flat or 2D image, so we want to take the lateral view. In the left lung, I spoke to you that the left lung is divided into upper and lower lobes, and we will take the major fissure from here to here and divide the lung into upper and lower lobe, and lower lobe is most posterior and the upper is more anterior, and the lower lobe is close to the vertebrae or dorsal vertebrae. So in AB or BA projection, we will see this as a 2D, and we can't to define the cavitation or the depth of the lung to can produce or to can define the lobar anatomy of the chest. And here in right lung, the right lung is divided into three lobes. We will draw the major fissure, and the minor fissure is originated from the major fissure, and this side is upper lobe and this side is lower and this side is middle. It's another image to make you more understand. In the left lobe, we will take the line from here to here, not oblique to the or not parallel to the costocardiac angle or cardiophrenic angle. It will be before it about 3 or 4 centimeters, and we will take oblique line. This is a oblique fissure or major fissure that divided left lung into upper and lower lobe. And in the lateral view of the chest, we will notice that the upper dorsal vertebrae is bright and the lower dorsal vertebrae is darker because the bones of the shoulder make it hyper dense. And in right lung, we will take the major fissure is before the costocardiac angle between 3 or 4 centimeters, and take the minor fissure from it in the level of the hilum region. We will take the minor fissure and divide the right lung into upper lobe and middle lobe and lower lobe. In another video, inshallah, I will talk about the lobar anatomy of the lung in the CT chest. Thank you for listening to me.